Hello and welcome to Docplexus News. Let's discuss this week's healthcare headlines that matter. The Union Cabinet has cleared the proposal for making senior doctors available from the central government for teaching and implementation of national health programs. After attaining the age of 62 years, these doctors will work exclusively in their respective fields of clinical expertise. The decision has been taken to strengthen teaching, patient clinical care and public health program. The CEO of Ayushman Bharat and Secretary General of AIIMS have met to discuss the potential collaboration in implementing Ayushman Bharat National Health Protection Mission. AIIMS representatives have agreed to extend their support for better implementation of empanelment of hospitals, spreading awareness and beneficiary identification processes. The National Board of Examinations, which regulates almost 7,000 PG seats, has refused to share inspection reports of hospitals on the basis of which seats were granted. In contrast to this, MCI puts all its inspection report on its website. Since PG seats regulated by NBE and MCI are equivalent, it is not clear why NBE cannot put its information in the public domain. The US FDA approved the first ever cannabis-based drug for the treatment of epilepsy made up of cannabidiol, a molecule found in marijuana plant. This approval is granted for use in patients aged 2 years and older with Dravet syndrome and Lennox-Gastaut syndrome, which is a rare form of epilepsy and most resistant to treatment. The US FDA has expanded the approval of a diabetes management device having automated insulin delivery and monitoring system for pediatrics with type 1 diabetes. The system includes a sensor to measure glucose levels and insulin pump and an infusion patch that delivers insulin. The device measures glucose levels in every 5 minutes and automatically adjusts insulin delivery. The Honorable Prime Minister Narendra Modi will be launching few key projects in AIIMS, New Delhi. These include the National Centre for Aging at AIIMS, inauguration of the super speciality block with 555 beds in Safdarjung Hospital and the connection motorable tunnel between AIIMS, Ansari Nagar and Trauma Centre. The launch of these key projects in AIIMS would prove to be beneficial for improving the health facilities in New Delhi. The Central Drug Standard Control Organization has proposed to bring 8 new categories of medical devices under the ambit of the Drugs and Cosmetic Act for effective regulation of their prices. The list proposed by CDSCO includes implantable medical devices, MRI, CT scan, defibrillators, dialysis machines, PET equipment, X-ray machine and bone marrow cell separator. According to a study co-led by WHO, a new drug formulation, carbetocin, can prevent excessive postpartum hemorrhage. This drug is found to be a useful alternative to oxytocin, which is currently recommended for preventing excessive bleeding after childbirth. This drug could save thousands of lives in developing and economically downtrodden countries. Diabetes has high prevalence amongst Indian population, which makes it important to understand diabetes and its newer management approaches. In this regard, Dr. Krishna Seshadri unravels his views on newer drugs for diabetes management.
I think what we've had in the last few years is drugs that address the various pathophysiological aspects of diabetes. And importantly, what these drugs have also done is allow us to examine this new pathophysiology. We would never have thought of the kidney as being an important cause of the pathology of diabetes. We know it is one of the targets of diabetes, but we've never talked about it as an important pathophysiologic cause of diabetes. So this group of drugs have helped us in one way. The second group of drugs, of course, is the GLP-1 receptor analogs, which have pretty much taken this by storm. And of course, we now for the first time have an anti-inflammatory in India that has been introduced as a drug in the management of diabetes. So we have some amazing new drugs, amazing new therapies, but we also need amazing new strategies to take care of this population.
Thank you, Dr. Seshadri. For the complete interview or queries, click on the link given below. These were the latest happenings in the medical field brought to you by Docplexus, one of the largest online communities of doctors. Stay tuned for more every Thursday at 6 p.m. Happy Docplexing!